Let's listen in.
Welcome, everybody. I think you're all able to see and hear me. We have several important updates today. And then really, this is also an opportunity for people to ask questions about what's going on in our state and some of our future plans. First, a brief update about where we are with regard to coronavirus outbreak in Colorado. 18,801 positive cases and 961 tragic deaths, and our hearts go out to all those who've lost a loved one or family member to COVID-19. I want to start by talking about the importance of wearing masks or facial coverings when you're in public. For us to be successful in the safer at home stage, for us to be able to open more sooner and quicker and save lives and be safer, it's really important for Coloradans to be responsible and wear masks when they're in public. Being successful during the safer at home stage means that, of course, for those who are seniors who have pre-existing conditions, it's best to stay at home whenever you can. Meanwhile, we're stepping up our testing and wearing masks in public. Now, we've, of course, ensuring that people have safest possible experiences in retail environments. People in stores should be wearing masks, and we owe them the common courtesy of wearing a mask as a customer as well, both for our safety as well as theirs. It's really important to do that. In some areas, it's required. Some many stores require it. But whether it's required in your area or not, the most important decision that you can make to affect your own safety if you do have to go out is make sure to stay 6 feet from others and wear a mask. And if wearing a mask is the price we have to pay for being able to have larger gatherings, return to churches, go skiing, go out to restaurants, I think that's a price that most of us would more than willingly pay. We miss everything that we love in Colorado. And for us to be able to do that in as safe as way as possible, in addition to responsible social distancing, wearing a mask in public will have a profound impact and get us all back to a lot closer to normal life sooner rather than later. They're already going back to playing baseball in South Korea. Frankly, I'm jealous. I wish the Rockies were playing now. But part of that is part of the reason that they're able to go back to that is because of widespread mask wearing in South Korea. Masks don't take very long to make. They're comfortable. They're easy. Most importantly, they will protect you and your loved ones from coronavirus. No protection is perfect. It doesn't mean you go right up to somebody who has coronavirus with a mask, but whether it's 30 or 50 or 70% protection, that means a lot mathematically across an entire society. And if we can increase mask wearing, we will be in a much better position to be able to return to the pews of our churches, restaurants, and bars sooner rather than later. So for anybody who wants to, and I certainly do, reopen parts of our economy and society sooner rather than later, mask wearing is extremely important. And I want to make sure people get that message. You'll get accustomed to it quickly. And by the way, you don't have to buy masks. You can certainly make them yourself. You can buy them, but you can easily make it out of old T-shirts or items that you have at home. You can visit coloradomaskproject.com for instructions on how to make your own mask and a list of retailers where you can get one or supplies. And I want to thank Colorado Mask Project for all their work. It's more than just a website with mask making instructions and a list of retailers. It's also a great collaboration between state government and private sector donors, companies that have stepped up to donate masks, nonprofits like the Colorado Coalition for the Homeless, and maker communities to deliver non-medical masks to vulnerable populations. Colorado Mask Project has given 82,000 masks out to 162 recipient organizations in 42 counties, and more are on the way. So they go right out to help our most vulnerable. And you can help them. You can help yourself to make your own mask, do a craft project with your family. But it is really important if we want to get things going sooner rather than later. The recipients have already included state early childhood groups, immigrant and refugee centers, veteran care providers, child care providers, and so many others. I also want to thank three companies in particular that have helped the Colorado Mask Project, among many others: Peak Beverage, Alliance Moving, and Lux Holding, as well as those who've donated materials for the masks: Hunter Douglas, Topo Designs, Pearl Izumi, Functionware, Denver Mattress Company, Tempur Sealy Osprey, Deuter, Eco Enclosed, Fashion Designer Center, GBS Sports, Spider and Dakeen, and Melanza. Um, Thank you for stepping up and being able to do this. And of course, thank you to the individuals who've been sewing and making masks for distribution. These groups have estimated they provided over 200,000 additional homemade and donated masks across the state. So if you are with a company that can donate masks or a Sutton cut and sew capacity or materials or an individual who would like to help sew, please get in touch. ColoradoMaskProject.com. It's making the difference every day. I also want to mention a couple of new initiatives the state is spearheading. The first one is called Can Do Colorado. It's where we're going to provide additional tips for businesses about how they can successfully have more telecommuting, highlight businesses that are being creative, doing things in a new and different way, and going above and beyond to run their businesses as remotely as possible. While across our state, businesses are back at least at half capacity, many businesses only have to have 10, 20, 30% of the people in the office. And we encourage businesses to continue to think out of the box, to be able to be productive, and this is not sacrifice productivity at the same time, not maybe able to allow people to stay at home. Physical therapy is often can be a little bit difficult to do while socially distancing. So creator Ed Forsman was able to meet his clients' needs by creating YouTube videos to instruct patients on how to maintain physical therapy progress. Those videos are available free of charge. They're shared by patients and followers alike. And now Ed, like many other physical therapists, is doing telehealth appointments to keep patients on track with their recovery. And when the stay-at-home order went into effect, we knew that there was a period of time where hair salons had to be closed. And just an example of an innovative Coloradan, Alexandria Grotto of the Glam House Salon launched a system for getting hair color treatments and beauty systems to her clients. And Alexandria and her stylists are available for a do-it-yourself walkthrough over FaceTime. And while many stylists are back, we're continuing to encourage Colorado businesses to use telework options, telecommuting wherever you can. Can't always do that for hair colorings and physical therapy, but some innovative Coloradans have found a way to do that. So let's get creative. If you want guidance, ideas, visit candocolorado.org just to read more about what great innovative Coloradans have done during this difficult time to be able to stay safe and make a living. I also want to highlight a program called Connect to Care Jobs that we're launching through the Department of Healthcare Policy and Financing in partnership with advancing states to match healthcare job seekers with immediate openings in residential care settings. Residents of our residential care and senior care facilities are very vulnerable to COVID-19, and we need additional staff both to cover for staff that is unable to work because of COVID-19 or themselves might be members of vulnerable populations. And you know what? I know that there's Coloradans looking for work right now. Well, there's areas that are hiring. So go to connecttocarejobs.com. That's connecttocarejobs.com to identify positions that you might be interested in, where you're able to travel and commute, and as well as other professional skills to make sure that you're the right match. There are additional hiring opportunities in grocery stores and Amazon as well. There are jobs and places that are hiring even in these difficult times. And I know that there are also many Coloradans that, having spent through the $1,200 the federal government found them and having lost their jobs, might be looking for work. So I hope that you're able to find those economic opportunities to support yourself in as safe a way as possible. I also want to remind Coloradans that if you lost your healthcare coverage because you lost your job, there are also options available for you. You might qualify for Health First Colorado, which is Medicaid, or the Child Health Plan Plus CHP program. You can visit co.gov/peak to find out if you're eligible, or call 1-800-221-3943. You can also sign up for individual insurance in the individual market at connectforhealthco.com or by calling 855-752-6749. One more thing before we take questions. It's going to be a nice weekend, we hope. But remember, try to recreate near your home when possible. engage in social distancing. We expect that people will be outdoors, and we're one of the few states that's had our state park system open through this entire pandemic, and we're very proud of that. Thank a state park worker and ranger if you from a safe distance if you happen to be going to one. But make sure not to crowd around. Make sure to keep from your family group or your group, keep a distance from others. If you're enjoying municipal parks, state parks, county open space, try to go off hours, do it in a smart way. We want to make sure that we're able to be healthy outdoors without jeopardizing the lives of those who surround us. Our amazing, majestic outdoor spaces have been here for tens or hundreds of thousands of years. They're going to be here long after we're gone. Do what we need to stay healthy, to stay outdoors, to recreate, but stay as close to home as you can during this period and keep yourself safe and your family safe. So with that, I would love to open it up, and this is primarily an opportunity for you to ask questions. A lot going on here with regard to the COVID-19 response in the state of Colorado, and we'll go to the first question.
Hi, Governor Polis, can you hear me?
Yes.
This is Taylor Summers for NBC News Radio in Denver. Denver Public Schools sent out a letter to parents saying the start of the next school year could be a mix of in-person classes and remote learning. I was wondering, will the state offer guidance to school districts on how to proceed with the upcoming school year, or is that going to be a district-by-district decision? And will the state be in a position to help parents who will hopefully be going back to work by then, but who will have kids who will be potentially learning from home remotely?
Yeah, we expect that schools will resume in-person classes in the fall. That doesn't mean that every parent or every child will want their kid in those classrooms, and we get that. I fully expect that parents and families will use online education more. We are working with the Colorado Department of Education to provide the guidance to school districts about safe in-classroom discussion, meaning how they can work to reconfigure their schedules to minimize contacts during passing time, space desks appropriately in the room, have smaller class sizes or staggered schedules where possible. But it is very important for our society, for our economy, and for the education of kids that they have the opportunity to resume in-classroom instruction this fall. And there's in-classroom instruction occurring today, not the regular in-classroom schedule, but many schools are available for one-on-one meetings, providing special ed services in small groups. Some of the classes that require equipment like shop or welding are coming back, so groups of 10 or less to be able to complete their technical certification for this school year. So we look forward to continuing to provide that guidance over the next month or so with CDE and others so that districts know some of those best practices for when they return in the fall.
Governor Charles Ashby from Grand Junction. Hey, so I've been looking a little more deeply into the CARES Act money that went to the nation's airports, the $10 billion. Immediately there was criticism over the funding formula that was used. Very small airports such as Hayden and Gunnison got like $18 million. Grand Junction got $5.5 million. Loveland, which has very little enplanements, got $18 million. So now, because of some of that criticism, the FAA has changed its rules a little bit so that those airports have to get that money within 4 years. And if they don't spend it for things like rent and debt service, that the money will go back to them. I'm wondering if you have any concerns about that. That means that a lot of that money won't end up helping airports. It'll just go somewhere else. There are a lot of people, some congressmen, who are calling on the FAA to redo the formula. Are you aware of this? Do you have concerns? Are you looking into it? Are you asking the FAA to change some things around?
Yeah, so we certainly want Grand Junction and other airports in rural areas of our state to the maximum flexibility to be able to use that money to be able to retain the basic operations, which are so important for our economy and our way of life. I would also encourage Congress to look at some of the inequities under the previous formula and consider additional help to some of our small rural airports to make sure that they can be viable because of their critical essential nature for freight, for passengers, for patients who need to be immediately flown or evacuated. And I hope that there's an additional work to provide that level of support to some of our smaller regional airports.
Hi, this is Navarro from Colorado Public Radio. I've got two questions. My first is, I know that there were 5,000 tests available to JBS. I know you were working with Senator Gardner and the White House. My question is, what happened to those 5,000 tests?
Well, as far as we know, there were no tests other than a few hundred that JBS conducted. So we set up a community testing clinic about a mile from the plant in Greeley and offered free testing for anybody who came. Well over 1,000 people participated. It was over several days, and we worked with county health to be able to supply those tests ourselves. And if the company is interested in more testing, we'd be happy to work with them to make sure they get the testing they need.
And the next one, knowing that nearly 60% of the deaths in the state have occurred among nursing home residents and that there are still outbreaks in nearly 150 homes for the elderly here, why has the state not tested all nursing home residents? And why is the state not testing every employee in nursing homes in the state every day?
Yeah, so nursing home employees are a top priority for testing. We're one of the first states to actually begin testing of asymptomatic nursing home employees, starting with the largest nursing homes in the state. We've used the Colorado National Guard, and we've also entered a partnership with Colorado State University with the goal of testing 45,000 workers at senior facilities across our state. Keep in mind that each test is only a point in time, and it's important to go back and do it again and again, meaning every week or 10 days or 2 weeks, being able to screen out asymptomatic employees who are contagious can help prevent the loss of life. We took some of the very earliest steps we took well before any of the stay at home or safer at home were to protect our nursing homes. There'd be far more loss that we would be observing today had we not acted quickly to limit visitation, to require people who work in nursing homes to wear masks, and for symptom screening for those who enter nursing homes and senior care facilities. We've been working on stepping up the compliance of that. By May 1st, about a week ago, every senior care facility had to submit to the state their plan for isolating anybody who has COVID-19, who shows symptoms, or who is positive. And we also have delivered substantial amounts of personal protection equipment to our senior care facilities. And as we ramp up testing, the asymptomatic workers and residents of senior care facilities continue to be one of the top priorities.
Hi, Governor. This is Blair Miller at Denver 7. Thanks for doing this again. And I was just wondering, we've seen, a lot less of the White House task force recently, publicly at least. And I was just wondering if that, and they've been talking about disbanding in coming weeks, even possibly. And I was just wondering how your administration's relationship has been with the federal partners since the beginning of this whole thing and how it's changed over time, especially regarding communication and supplies.
Yeah, we value our partnerships with the private sector, with the federal government. As here in Colorado, we're grateful for masks or for tests wherever we get them from. Whether it's 100,000 COVID-19 tests that we purchased from South Korea, whether it's masks that the federal government is delivering to our senior care and nursing home facilities. We see them as a partner. They're not the only partner. It's been very clear from the start that states are on their own to be able to navigate the supply chain. We brought in top leaders from the private sector and public sector early on, as well establishing a economic recovery and growth council at the state to really make sure that we can get things going as soon as we can, ahead of many other states with regard to the economy and additional freedoms for Coloradans.
Governor, this is Evan Weiloge, Colorado Springs Gazette. You've spoken about mobility and data that you've gotten that is cell phone data from a third-party company. One, what do the most up-to-date numbers say now about Coloradans' social distancing since the restrictions have been eased? And two, what else can you say about the source of that data and how frequently you're provided updates?
Yeah, there's daily updates to data models that reflect mobility in our state. We're hitting the benchmarks that we hope to. Of course, there's big changes with the Denver metro area now, going from stay at home to safer at home. But it's really so far meeting the metrics that we hoped it would meet. Coloradans are doing a good job minimizing their social interactions. What it doesn't really provide is, are people 6 feet away from one another or 8 people away from one another? Are they wearing masks? None of that would be in metadata that shows movements of large numbers of people on highways and across our cities. So it's part of the picture. It's encouraging, but it doesn't really determine the health outcome. We're also hopeful that Coloradans are remaining 6 feet apart where they can and wearing masks when they're in public.
Hi, Governor. Jesse at the Colorado Sun. You've said that you're going to be monitoring the data closely to determine next steps and see if Colorado needs to go back and put some of these restrictions back in place. I'm wondering what those thresholds are that you're looking for in terms of what might prompt you to go backwards in terms of tightening restrictions on Coloradans' movement.
Well, it's really the criteria we laid out in mid-March when we were first talking about this. We want to make sure that we don't overwhelm the hospital capacity in our state and unnecessarily lose lives that could have been saved if they had a hospital bed. And that applies to both COVID-19 as well as non-COVID-19 medical needs, whether it's somebody who has a heart attack or cancer, or whether it's somebody who has COVID-19. We want to make sure that they have the fighting chance to get through it. With COVID-19, the good news is that most will, and most will only require oxygen in a bed for a period of several days or even weeks. In some cases, of course, they'll require ventilation, then the survival rate is closer to 50%. But we want to make sure that every Coloradan who contracts COVID-19, as well as any other medical condition that requires hospitalization, has the capacity there to be able to serve them. Jesse, do you have a follow-up on that? Because I think I might have answered only part of your question.
Yeah, I'm just wondering if you can give us kind of specific numbers, if like there's a case number that we would hit or like a level of hospitalizations that would trigger us going back.
Yeah, so we monitor the hospital capacity every day. Now, hospital capacity is a tailing indicator. That's why mobility tracking is so important. It's also why the testing data and the positivities were down to 10% positive test rate, but why that's also important, because from when somebody's exposed to COVID-19 to when they're diagnosed to when they're tested, and then to finally, if they need to be hospitalized, that's often 7 to 10 days after symptoms begin. So we don't want to wait till the hospitals are full to make these decisions. We want to be tracking this earlier in the process, and we are around diagnosis and around testing and around mobility to make sure that we're in a position of the hospital capacity we need. We've also been working with the hospitals to expand their capacity. They've expanded their ICU capacity by about 20% since the start of this crisis, and we have the additional non-ICU beds in place in Loveland and Denver if we need them for the non-ICU cases.
Hey, Governor, this is John Herrick with the Colorado Independent. A group of criminal justice reformers, including the ACLU, are calling on you to order the commutation of inmates in the state's prisons, as well as implementing some additional parole reforms. They're saying that your current executive order is not working fast enough and that COVID-19 is continuing to spread. I'm wondering what your response is to those requests and whether or not you are considering to commute the sentences of certain inmates.
Any congregate living facility is vulnerable for an outbreak. It's nothing unique about prisons. It could be college dormitories, senior centers, any place where you have a lot of people living together, dining together, needs additional protection, additional measures. We've taken many of those around our prisons. Both the prison guards and the inmates are wearing masks. When there's positive tests in a cell block, there's a lockdown. Anybody who tests positive or is symptomatic is removed and isolated. And of course, our prisoners, like other Coloradans, have access to the medical care they need to get better if they contract COVID-19. So it shouldn't be any surprise, folks in congregate care settings. This will be the case for college dorms. They're out now, but they'll be back. And of course, there'll be a higher vulnerability. Senior care and living facilities, as well as, of course, our prisons are at risk of breakouts. Many of them have had these kinds of breakouts, and we've taken quick action when they have to be able to isolate people who've had it and also limit transfers between the prison system. I would just say, if anybody is looking to COVID-19 as an excuse to let dangerous criminals out, then they have the wrong governor. We're certainly not going to be letting dangerous criminals out, and we would never even contemplate such a thing.
Hi, Governor Polis. This is Libby Smith with CBS4. So some restaurants are telling us that they are hearing they'll be allowed to open the weekend of June 14th. Is that true? And what needs to happen for restaurants to open?
Well, we certainly hope it's sooner than that. When we laid out what May would look like, I expressed a goal of opening restaurants in May. I'm still confident that that'll occur, but it's data that we don't have yet. So we're going to take a look at the data really the week of the 22nd, 23rd, right around then. It'll be about 3 weeks of data from the safer at home phase. And then, of course, restaurants need, 5-6 days to open, a week to open. But we would love to be able to be in a health situation that will allow them to open before Memorial Day weekend. But that'll all be decided based on data that we don't have yet, don't have a crystal ball, and we'll see where that data emerges. I certainly hope it's prior to June 15th.
Hi, Governor. Katie Pelton with KKTV 11 News in Colorado Springs. El Paso County tells me they officially submitted their high school graduation proposal to the state last night. Do you plan on approving that proposal? Thank you.
Yeah, El Paso County has submitted what's called a variance, meaning they have some very innovative and thoughtful ways for high school seniors to recognize the rite of passage in a safe way. Very similar to the way that the Air Force Academy did their graduation not too long ago, which means students outdoors, spaced apart. What's tough for everybody is it's without our friends, our family, our grandparents, our aunts and uncles being able to be there, but it will be broadcast for them. And the county health department is working with the state health department for the final sign off on that plan. But it really shows how things have to be done in a different way because of the dangers of this virus. And thinking while honoring the rite of passage of our high school seniors who work so hard. And I really applaud the school districts of El Paso County, as well as the commissioners for diligently working on a way to do that. Any remaining questions?
Jesus, you're on
Hello,
the
Governor.
line.
Go ahead.
I'm Jesus from Noticias Univisión, Colorado. Gobernador, nos gustaría saber cuántas personas se han recuperado de coronavirus en el estado, porque muchos nos han preguntado por qué no se dan a conocer estas cifras.
Ya la mayoría que personas quien tienen COVID-19 a mejorar y a tener su salud completo después de una semana o 2 semanas o 3 semanas. Es solamente casi 1% desde 2% quien matan de coronavirus. La mayoría son en buena salud después de recuperar. ¿Te contesté? ¿Sí?
Okay.
Okay.
Hi, Governor. This is Vinny Del Judas at Bloomberg News in Denver. Families are in need of food assistance. How are Colorado's food banks and social services handling this crisis? Are there any shortages in parts of the state? And can the government, the state government, and the local governments of the state actually help out in this matter? Thank you very much, sir.
Yeah, our food banks across the state are seeing increased demand. We are working with them through Department of Human Services and Michelle Barnes, which prior to joining my administration was the executive director of Food Bank of the Rockies, to find creative ways to help make sure that we can help meet the food needs of our residents. I know there's also been discussion at the national level of increasing SNAP payments temporarily to allow people to have more options to purchase healthy food.
Hi, it's Jessica with the Post. With Denver's stay-at-home order ending, what are you wanting to see in the city, as businesses start to reopen?
Well, I'm excited that Denver and the rest of the metro area is now entering the safer at home stage. I think we're all excited to see businesses open and people being able to go back to work. What's important, just as it has been in the areas of the state that have been open for a week and a half, is that we need to be responsible. It's not a free for all. Wear masks in public, honor the spacing requirements, both for the workers in stores as well as for yourself. We want to do this in as safe as way as possible. For those who are going into offices on Monday, many offices are going to be at 50%, but we encourage those offices that are able to get all their work done with 20 or 30% in place because the rest can telecommute. Another creative way to do it is to stagger shifts in manufacturing, as an example. Maybe you used to have one shift come in, and you can now have half the people come in and work two shifts to meet that same productivity goal and make sure that workers can continue to earn their salaries. So the world is figuring this out. There's creative and innovative ways to do this in a sustainable way, in as safe way as possible. And we're very excited to work with our partners in the Denver metro area to be able to enter this new phase that is more sustainable over time.
Aaron, you're on the line.
Hello?
Sorry. Hi, this is Erin Prater with the Gazette. I was curious, at a previous press conference, you had spoken about gauging the success of social distancing measures based on CDOT data. My colleague Evan just asked about data from mobile cell phones, but how successful are we in social distancing as a state based on CDOT data?
Yeah, so those are both part. I think the earlier question was real. I took it as being about both. We use mobility data. Some of that is the highway and CDOT data. Some of that is the cell phone data through Google and other sources. So what all of that shows is that there's no alarms on that. We think we're hitting the benchmarks. That's all it can show is that we're doing it, right? It's an early indicator. The next indicator is the testing and the data and the diagnosis, and then finally hospitalizations, and then tragically at the end of that cycle would be death in some cases, hopefully successful recovery in most. But so far, there's no red flags in the mobility data. Now, we're really going to be watching it closely after the Denver stay-at-home ends, because next week will really be a lot more relevant information from the mobility side about what's going on. And I also want to point out, as I did before, the things it doesn't tell us. It doesn't tell us when people are going out whether they're successfully staying 6 feet apart from one another. And it doesn't tell us whether people are successfully wearing masks when they're in public. So those are two data points that we hope to have some way of monitoring, but really ultimately it will be reflected in what the infection rate is.
Hi, Governor Polis. Derek Draplin here with the Center Square. Earlier this week, Colorado Parks and Wildlife announced it was extending its camping ban until further notice, with no definitive date known for reopening campsites, while parks and many trails still remain open, as you mentioned. Can you explain the data and reasoning behind that decision? And are you at all optimistic that some campsites might be reopened by Memorial Day?
Yeah, I'm very optimistic. I'm very hopeful that Parks and Wildlife will be able to open campsites soon. I've encouraged them to do so. We want to be respectful of the host counties. Some counties are not ready for visitation yet. Other counties are. But we have been one of the few states that have kept our state park system open through this entire crisis. We're very proud of that. When you see a ranger or Colorado Parks and Wildlife employee, thank them from a safe distance for being out there and having our beautiful outdoor recreation areas be available throughout this crisis. And I'm confident that camping sites will be reopened soon as well.
Hey, Governor, Jesse Paul again. You just mentioned those campsites reopening potentially by Labor Day or Memorial Day. I wanted to see if that means you're thinking about dropping the 10-mile travel limitation on Coloradans. And also I wanted to see if you've had a chance to go through President Trump's order keeping meatpacking plants open, and whether or not you found anything in your going through that, I think you said, with a fine-tooth comb.
Yeah, so we on the JBA, we found that we really do still have the ability with the county health department and the state health department to be able to have health orders to help keep the workers safe at a facility like JBS if needed. So that authority has not been taken from us. They have been under a health order. They were closed for 14 days. If they need to be closed again, we are confident that we have the tools to be able to do that. The whole issue of traveling across the state is a challenging one. It's really as much for the residents of communities that are impacted by visitation. I had a call with a number of commissioners today, including commissioners from Eagle and Garfield County, Mesa County, many others, and they feel they're not ready yet to receive visitors. Nobody has more at stake economically and from a health perspective than the residents of the communities that receive the visitation. So while people in the Front Range might be angling to get to the high country, wanting to engage in tourism within our state and visitation, we need to be very mindful and respectful of the people that live in the host communities. And I think that they're getting there, just like the rest of us are. I think it's a natural cycle. They're understanding the economic need to get there more and more. They're understanding the precautions that can be taken to minimize risk and reduce the safety dangers in those communities. But the overwhelming consensus is they're not yet ready to receive visitors from across the state, across the country, or across the world. I want to thank all of you for joining us in this digital press conference. We'll be back in person. We aim to be as accessible as we can through a number of opportunities to ask us in person or digitally through this. Coloradans, let's stay safer at home. ColoradoSaferAtHome.com is the website with the guidance. Wear a mask when you're in public. Try to stay 6 feet from others and stay home whenever you can. That is the formula that will allow us to reopen as quickly as we can, be one of the leading states in getting an economic growth curve going, get people back to work and back to the quality of life that we all treasure as Coloradans. Thank you all.
You've been watching Governor Jared Polis answer questions about the state's response to the COVID-19 pandemic. Polis announced a new initiative called Can Do Colorado to advise businesses on working remotely, and another initiative called Connect for Care Jobs to match healthcare job seekers with employment. He also said he will review the data to see if restaurants could resume in-person dining by Memorial Day. The governor also reminded Coloradans not to crowd while recreating this weekend. He stressed the importance of continuing social distancing and wearing a mask when you leave your home so the state can reopen quickly and safely. Thank you for watching. I'm Jessica Porter. I hope you can join me later today for Denver 7 News at 4.